Let's talk about angiotensin converting enzyme inhibitors, ACE inhibitors, ACE inhibitors, in which we have the captopril, enalapril, lisinopril, ramipril. The mechanism is inhibit the ACE. When you inhibit the ACE, you cannot form angiotensin 2. When you cannot form angiotensin 2, that leads to decrease in GFR by preventing constriction. You are preventing the constriction of efferent arteriole. When you are in preventing the constriction of efferent arteriole, you're decreasing the GFR. Again, increased renin would be there due to the loss of negative feedback by angiotensin 2. So there's going to be increase in renin. Inhibition of ACE also prevents inactivation of bradykinin, a potent vasodilator. So when you're prevents the inactive, when you're preventing the inactivation of bradykinin, that means the bradykinin is going to be present active. That means it is going to cause vasodilation. Secondly, it's going to cause cough. Okay, the hype and the adverse effect, you can see the cough. So, but look at in the clinical uses now. It is used in hypertension, heart failure, proteinuria, diabetic nephropathy. Prevents the unfavorable heart remodeling. Very important. It prevents the unfavorable heart remodeling as a result of chronic hypertension. So, what is a drug that can be used to prevent heart remodeling in chronic hypertension? That's ACE inhibitors and ARBs. And some sort of beta blockers as well. But here we're just talking about ACE inhibitors and ARBs. In chronic kidney diseases, example diabetic nephropathy, decrease in intraglomerular pressure showing GBM thickening. That's clinical use of it. Well, the adverse effects, we have the cough, we have the angioedema, both because of increase in bradykinin, which is contraindicated in C1 esterase inhibitor deficiency. So if you have a C1 esterase deficiency, these drugs are contraindicated. It is teratogenic. Fetal renal malformation can occur. Increases in creatinine because of decrease in GFR. Hyperkalemia can occur. Hypotension can occur because you're inhibiting the ACE. Used with caution bilateral renal artery stenosis, because if you have bilateral renal artery stenosis, you have already decreased GFR, you have already increased the creatinine, and so you really want to use caution when there is a renal artery stenosis, because you don't want these two things, this thing to go high, way too high, and this thing to go way too low. As they have mentioned here, because the ACE inhibitor will further decrease the GFR, can lead to RF, renal failure. Captoprils, catch is the mnemonic for captoprils on all of them. So that's for the angiotensin converting enzyme inhibitor.